Hi viewer, today in our video we will see chapter 3 ICD changes. Chapter 3 is diseases of the blood and blood forming organs and certain disorders involving the immune mechanism. The code range is from D50 to D18. Coming to the changes. New codes have been created in hemolytic uremic syndrome. Von Willebrand's disease codes has been expanded to accommodate the type of von Willebrand's disease. Several new codes in heparin induced thrombocytopenia and new codes in other specified diseases of the blood and blood forming organs, combined immunodeficiencies. Coming to the hemolytic uremic syndrome. Hemolytic uremic syndrome is a condition that affects blood and blood vessels. It results in destruction of platelets, low RBC, and kidney failure due to damage to the tiny blood vessels of the kidney. Other organs such as brain or heart may also be affected by damage to very small blood vessels. Coming to the codes, till now we have only one code, that is D59.3, hemolytic uremic syndrome. In 2023, 4 new codes have been created. They are D59.30, hemolytic uremic syndrome unspecified, D59.31, infection associated hemolytic uremic syndrome, D59.32, hereditary hemolytic uremic syndrome, D59.39, other hemolytic uremic syndrome. Whenever you are coding D59.3, that is hemolytic uremic syndrome, if the patient has any associated acute kidney failure or chronic kidney disease, please report them additionally. Coming to the unspecified type, D59.30. When the patient the type of the hemolytic uremic syndrome is not specified in the medical record, then assign D59.30. If it is passed from the parents through the children through genes, then assign D59.32 for hereditary hemolytic uremic syndrome. D59.31, infection associated hemolytic uremic syndrome, and D59.39, other hemolytic uremic syndrome, has few conventions. We will see them now. D59.31, infection associated hemolytic uremic syndrome. It is also called sugar toxin producing E. coli related hemolytic uremic syndrome or typical hemolytic uremic syndrome. Whenever the patient has associated E. coli infection B96.2, human immunodeficiency virus disease B20, pneumococcal meningitis G00.1, pneumococcal pneumonia J13, sepsis due to streptococcus pneumoniae A40.3, Shigella dysentery A03.9, streptococcus pneumonia as the cause of diseases classified elsewhere B95.3. Whenever the patient has these list of conditions associated with D59.31, please report them as additional codes and D59.31 as a primary diagnosis. Coming to the guidelines. Whenever the patient is admitted for HIV related condition, so primary diagnosis will be B20, that is human immunodeficiency virus disease followed by HIV related condition. But there is an exception to this guideline. It was added during this year. That is, if the reason for the admission is hemolytic uremic syndrome associated with HIV disease, then assign D59.31 as a primary diagnosis followed by B20, human immunodeficiency virus disease. Please remember this guideline. It was added newly in 2023 changes. Coming to the hemolytic uremic syndrome associated with sepsis. If the reason for the admission is hemolytic uremic syndrome associated with the sepsis, then assign D59.31, infection associated hemolytic uremic syndrome as a primary diagnosis and underlying systemic condition should be coded as secondary diagnosis. Next one is D59.39 other hemolytic uremic syndrome. It is also called atypical hemolytic uremic syndrome or secondary hemolytic uremic syndrome. It has three conventions: code first, code also, use additional code. Coming to the code first condition, these are the causal conditions. They should be reported as primary diagnosis, and D59.39 should be reported as secondary diagnosis. Whenever the patient has hemolytic uremic syndrome associated with COVID-19 U07.1, complications of the kidney transplant T86.1, complications of heart transplant T86.2, complications of liver transplant T86.4. Please report these conditions as a primary diagnosis and followed by D59.39 other hemolytic uremic syndrome. Next one is code also conditions. Code also conditions will be reported additionally in addition to the D59.39. They are hypertensive emergency I16.1, malignant neoplasm C00 to C96, systemic lupus erythematosus M32. Whenever the patient has these associated conditions, report D59.39 as a primary diagnosis and these conditions as secondary diagnosis. Coming to the use additional code. You all know about adverse effect coding guideline, right? Whenever the patient has adverse effect, that adverse effect which results in some sign or symptom or the condition, those should be coded as the primary diagnosis followed by adverse effect T code in the secondary diagnosis. Here, if the patient has hemolytic uremic syndrome due to adverse effect of a drug, then code D59.39 as a primary diagnosis and adverse effect of the drug T36 to T50 as additional diagnosis. We'll see few examples. The first one is patient admitted for hemolytic uremic syndrome associated with hypertensive emergency. Hypertensive emergency condition was found in code also list. So it should be reported as additional diagnosis. That means I16.1 hypertensive emergency should be reported as a secondary diagnosis and D59.39 as a primary diagnosis. If the patient was admitted for hemolytic uremic syndrome that is associated with COVID-19, then COVID-19 was found in code first conditions. So U07.1 as primary diagnosis and D59.39 other hemolytic uremic syndrome as secondary diagnosis. Whenever you are coding hemolytic uremic syndrome, please check the type of hemolytic uremic syndrome and assign appropriate code. The next one is von Willebrand's disease. What is the von Willebrand's disease? How it occurs? It is a bleeding disorder in which blood doesn't clot properly due to low level of von Willebrand's factor or the protein doesn't perform as it should. What is a von Willebrand's factor? Von Willebrand's factor is a protein that helps for the blood clotting. So whenever this von Willebrand's factor is at low level or it doesn't perform as it should, in such conditions the patients will get von Willebrand's disease. And also another protein, that is factor VIII. It acts as a cofactor for the blood clotting. So that is also one of the important factor which helps for the blood clotting. Now we will see types of VWD. Type 1, type 2 and type 3. In type 2 there are subtypes are there: type 2A, type 2B, type 2M, type 2N. Coming to the definition of the first, we will see the definition of type 1. This is the most common and mildest form of VWD. This type has lower than normal level of VWF, also might have a low levels of factor VIII. Type 2. In this type, body makes normal amount of VWF, but the factor does not work the way it should. Type 2A. The VWF is not the right size and doesn't help the platelets attach in order to form a clot. Type 2b. The VWF attaches to the platelets at the wrong time when there is no injury. The body removes the platelets attached to the VWF, causing the reduced amount of both platelets and VWF in blood when needed to form a clot. Type 2m. The VWF does not attach to the platelets as it should, which decreases the platelets' ability to form a clot when injury occurs. Type 2n. The VWF attaches to the platelets normally, but it does not attach to the another protein, that is factor VIII, which is also needed for both blood to clot. This causes the body to remove the factor VIII protein. Type 3. This is the most severe form of the VWD, in which a person has very little or no VWF and lowest level of factor VIII. So these are the types of VWD. We have new codes and they are created during 2023 for these types. So henceforth, whenever we are coding VWD, we have to check the type and assign appropriate code. D68.0 von Willebrand disease. This is the only one code it exists till now to code this condition. This year 10 new codes have been created. They are D68.00 von Willebrand disease unspecified, D68.01 von Willebrand disease type 1, D68.020 von Willebrand disease type 2, D68.021 von Willebrand disease type 2b, D68.022 von Willebrand disease type 2m, D68.023 von Willebrand disease type 2n, D68.029 von Willebrand disease type 2 unspecified, D68.03 von Willebrand disease type 3, D68.04 acquired von Willebrand disease, D68.09 other von Willebrand disease. These are the 10 codes based on the type of the von Willebrand disease. Assign appropriate code. Coming to the next one, heparin induced thrombocytopenia. Patients receive blood thinner, that is anticoagulants, to treat or to prevent blood clots. The most commonly used intravenous anticoagulant is heparin. This heparin does the opposite what it should supposed to do. It forms new blood clots rather than prevents. Usually, heparin prevents clotting and does not affect the platelets or the components of the blood that help to form the blood clots. In response to heparin, immune system triggers and causes low platelet count. That is heparin induced thrombocytopenia. There are two distinct types in heparin induced thrombocytopenia. They are non-immune heparin induced thrombocytopenia and immune mediated heparin induced thrombocytopenia. Coming to the first one, non-immune heparin induced thrombocytopenia. It occurs most frequently, characterized by mild decrease in platelets count and is not harmful. It occurs between 5 to 14 days after the first beginning of the heparin therapy. The second type is immune mediated heparin induced thrombocytopenia. It occurs less frequently, but it is more dangerous and it causes much lower platelet counts and also at risk for major clotting problems. Coming to the pathophysiology of the HIT. After the heparin administered to a patient, an immune complex can form between heparin and a specific blood factor that is PF4, platelet factor 4, that is released by platelets. Then the body treats as PF4 heparin complex as foreign substance. Therefore, an antibody is formed against heparin PF4 complex. This antibody binds to the complex and platelets are destroyed. The disruption of the platelets can lead to formation of the new blood clots. In patients with immune-mediated HIT, the results can be a deep vein thrombosis, pulmonary embolism, or even heart attack or stroke. However, it does not occur with non-immune HIT. It can be diagnosed by measuring the platelet counts and PF4 antibody level in the blood. Coming to the codes, D75.2. This is the only one code for heparin-induced thrombocytopenia. In 2023, there are 4 codes. D75.821, non-immune heparin-induced thrombocytopenia. D75.822, immune-mediated heparin-induced thrombocytopenia. D75.828, other heparin-induced thrombocytopenia syndrome. D75.829, heparin-induced thrombocytopenia unspecified. These are the codes. While coding heparin-induced thrombocytopenia in 2023, check the appropriate type and then assign appropriate diagnosis as per the new guidelines. Coming to the other specified diseases of the blood and blood forming organs and combined immunodeficiencies, we have 2 new codes. First one is D75.84, that is other platelet activating anti-PF4 disorders. The second one is D81.82, activated phosphoinositide 3 kinase delta syndrome. It is also called APDS. Coming to this APDS, this is an immune system disorder. It can lead to low number of the WBC and may result in conditions ranging from recurrent infections to lymphoma. Till now, there is no specific code, so they cannot track and treat appropriately for this year onwards. As a specific code is there, I think maybe the better treatment provided to patients. These are the changes for chapter 3. Just before going to end this video, just we will revise the codes once. D59.3, that is hemolytic uremic syndrome. The new codes are created for infection associated, hereditary and other hemolytic uremic syndrome. D68.0, this is PWD. Codes expanded to accommodate type of VWD, that is type 1, type 2A, 2B, 2M, 2N and type 3. D57.82, heparin induced thrombocytopenia. New codes are created for immune mediated, non-immune mediated and other HIT. D75.84, other platelets activating anti-PF4 disorder, and D81.82, APDS, that is activated phosphoinositide 3 kinase delta syndrome. So these codes are created. So these are the chapter 3 revisions and updates and guidelines, and we will meet in the next video with chapter 4 changes. We'll meet you soon. Please share and subscribe our channel.